as campaigning enters its final week.
The time is 28 minutes to 9. Health is always an election battleground. Last time, the key figure was the £8 billion increase put forward by NHS England. Today, the NHS Confederation, which represents health groups in England, Wales and Northern Ireland, has come out with an idea that it hopes the parties will take on, linking health spending to national income, along the lines of what happens at the moment with foreign aid and with defence spending. Niall Dickson is Chief Executive of the NHS Confederation. Good morning.
Good morning.
Why do you think this is a good idea?
Well, we recognise the election is going to be dominated by Brexit, but we think that both the political parties and indeed society as a whole has got another set of really crucial decisions and choices to make about the future of health and care in this country. So that's why we're advocating, first of all, that health and care need to be brought together so one doesn't lag behind the other, which they have done in the past. Secondly, as you say, that we link it to the success of the economy. So as the economy grows, then funding on health and social care could grow.
What happens if the economy doesn't grow?
Well, I think you would then be facing the situation that you were in 2008-9, and it really doesn't matter whether it's linked to GDP or not. Any government is going to find itself with really very difficult choices and decisions if the country goes into recession. Obviously, we would make a very strong argument about the levels of need and not falling so far below that you fail to meet even basic standards of need. But I think that's a decision which would happen irrespective of whether you tied it to GDP or not. But if you do tie it to GDP, it does give some clarity and certainty around it. And if you look at the history, both in terms of what's happened with defence and in terms of foreign aid, we think that so great a set of decisions have to be made about health and care. We're looking at a situation where the number of people over 85 is going to double in the next 20 years.
Right, but
easy to say, but it's a massive change.
It is a massive change, and that is precisely why linking the needs of the health and care system to our national income is an artificial one, because we know that is going to grow. So, whereas we also know that our economy can go up as well as down.
Well, we do, but of course any government is quite rightly going to say we can only spend what we can afford to spend as a society, and that's a perfectly reasonable argument. I think if you have any degree of optimism about what's going to happen to the economy over that period of time, it's much more likely that the economy will grow and we won't keep up with spending. That is the history since the NHS began.
So that's the assumption that you're making behind this. So at the moment, if we look at it in the way that you're putting forward, we spend less than 10% of our national income on health. So where should we get to? Because we know, for example, defence 2%, foreign aid 0.7%. What should it be for health?
Well, we're not coming out with a figure because we believe there needs to be an independent assessment that is separate from the political parties, which looks both at the current situation, which we do think the system is underfunded as of this moment.
So then more than 10%?
Yes, it's very likely to be more than 10%. And if you look at the trend of what's going to happen over the next 10 or 15 years, we need to have a very serious conversation, both about the overall level of spending and indeed in social care terms, where that money is going to come from.
Exactly. So let's say we took the current 10% to 11%, which would be comparable with France, Germany, other comparable industrialised countries. That would amount to an extra £20 billion a year.
Yes, it would be a significant amount of money, and we're not calling for that increase now. What we're saying is we need an independent assessment. It may take time to reach the level which is required. We have to recognise the fact that the extra funding is necessary but not sufficient. We've got a workforce crisis which government needs to help the NHS with, and there's a transformation crisis. We need to change the way services are organised. So it's not just about funding, but the funding issue is absolutely crucial if over this longer period we are to face up to that challenge of the growing number of elderly people who will have a whole set of needs which are not currently being met.
But even if you're not calling for an extra 20 billion today, there's still a fundamental question about whether you think most of that increase should come from taxation, from cuts elsewhere, in the case of health, from private streams of income. What do you think?
Well, I think you have to differentiate historically between the NHS on the one hand and social care on the other. Social care has always involved a degree of co-payment. It's always had individuals contributing. And the current administration has launched a look at long-term social care funding. And a number of ideas are emerging from that about how individuals may be able to contribute more towards their own care.
But most of it would come from taxation.
Most of it would come from taxation, and this is a political argument. It's not, I think, one for the NHS itself, but it's reasonable for the NHS to say, if you want this level of service, you will require this level of funding.
Niall Dickson, thank you very much. Of course, we'll be talking much more about health over the election campaign. We are also asking you what issues you think we should look at before June the 8th. It's for a series of reports we're calling Off the Grid, and you can give us your suggestions.